Lindsay Daniels, I'm the System Executive Director for Care Management at Sanford Health, and I was the executive sponsor for our initiative of starting Sanford CareSignal, which is a Lightbeam product. We started in 2022, and we had 3 programs live of diabetes, heart failure, and depression. Since then, we've expanded to add COPD and then a post-discharge program. Depression is our most utilized program within our system. It has the highest activation rate and engagement rate for our patients among all of our programs. We've seen the most engagement just with our ability to reach out and connect with those patients in real time of when they really need us. We know that behavioral health and access to behavioral health providers is something that is most health systems are looking at about how to increase access. And so that ability to stratify our patients, understand who really needs us in that moment of time, we can connect with them. We were early on in our development with Deviceless remote patient monitoring, and so we didn't know a lot. It was marketed to us as a out-of-the-box product, but what we were able to do is to work with CareSignal and Lightbeam to understand where could we make some changes that would be unique for us, that we really felt was important to our patient population, who we were trying to reach and why we wanted to reach them. Value-based care is really important to our organization, and as we move farther and farther down that trajectory of taking on more risk, our ability to scale our resources because of the limited staffing that we have or capacities with the staffing that we have, it's really important for us to be able to, at scale, connect with our patients. And so just to continue to offer CareSignal to our patient populations, understanding the populations that we most want to reach and what programs are available within CareSignal. Having multiple programs, we can look at our data and our populations and see where we have the gaps and where CareSignal can fill those gaps for us. Right now, one of the biggest issues that most healthcare systems are facing is staffing constraints and the patients needing us, right? There's more patients that need us than we have the resources today. Also, just it's a scalable solution for us to be able to identify the patients who really need us in that time, so that we can target the right clinician for that patient and use them at the top of their scope, the top of their licensure, to connect with the patients who really need us, but also without losing track of the patients that maybe are that rising risk or kind of starting to bubble up to that high risk threshold. It helps us connect with those patients earlier on in their disease and their illness process so that we can intervene, and our interventions are less intense than they would had they escalated without intervention. I love our partnership with CareSignal. They have, everyone that we've worked with at the company has been engaging, very knowledgeable, able to take our suggestions and bring it back to the company and help make improvements that we would think were improvements for our specific programs, and then also just being able to provide suggestions to us about ways that we could improve. Like I said, we are early in our journey of deviceless remote patient monitoring, so having the experts that have worked with several organizations of our size to be able to do scale best practices was amazing.